The labor and delivery floor at a tertiary hospital in a metropolitan area is conducting a monthly huddle for new orienting nurses on HELLP syndrome. This floor has over 1,000 deliveries per month and has a 40-bed NICU, fetal medicine diagnostic center, and maternal fetal medicine team on call. This hospital is located in a 6 to 8% high-risk population, a 67% minority population, and a 33% Caucasian population. Red blood cells are broken or fragmented when they pass through damaged vessels, thus causing hemolysis. This results in decreased blood flow to the liver, causing elevated liver enzymes from the obstruction to deposits of fibrin, a component that aids in clotting. A decrease in the function of the liver causes impairment of the organ, which is primarily due to the necrosis of the tissue from inadequate blood flow. This process results in right upper quadrant pain, nausea, vomiting, and jaundice. The damaged vessels also contribute to decreased platelets, elevated liver enzymes, vasospasms, and thrombocytopenia at damaged areas. The nurse will be able to recognize signs and symptoms of HELLP syndrome by the end of the instructing period. The nurse will be able to implement appropriate interventions for the management of HELLP syndrome by the end of the instructing period. The nurse will be able to educate the at-risk client on prevention strategies and healthy living by the end of the instructing period.
Hey guys, welcome to today's period of instruction on HELLP syndrome. You guys know it stands for hemolysis, elevated liver enzymes, and low platelets. So today, after this period of instruction, you guys are going to be able to better recognize signs and symptoms of HELLP in a client, implement proven strategies to manage the signs and symptoms, and you're going to have some valuable tools or resources to help educate the client who's at risk about prevention strategies and healthy living. So some signs and symptoms of a client that you're going to see who has HELLP are severe headache with vision changes, could be with or without vision changes, high blood pressure, typically around 140/90, severe nausea and vomiting, and another indicator is right upper quadrant pain. Some diagnostics that you're probably going to see are blood draws, and that includes platelet levels, H&H, liver enzymes, AST, ALT, bili, creatinine, and definitely a BUN. At-risk patients who you're going to see come in here, if they have a history of preeclampsia, multiple gestation, they have chronic hypertension, diabetes, renal disease, or any kind of autoimmune disease. Secondly, you're going to be able to implement proven strategies. So there's 4 main concerns and main treatment goals that we have for clients who come in with HELLP syndrome. Those include lowering the blood pressure, preventing seizures, promoting lung maturity with steroids of the infant, and delivering that baby. So first off, lowering blood pressure, we're going to be using some rapid-acting IV antihypertensives. To prevent seizures, we'll be using mag sulfate. That's the go-to gold standard to prevent seizures with clients who have HELLP. Promote lung maturity, we'll be using betamethasone in the clients who want to be able to stave off that birth for around 96 hours to be able to let the betamethasone work in the infant and develop those lungs, and then deliver baby. Okay, so that third objective, you're going to educate the at-risk client about prevention strategies and healthy living. So the 4 things we really want to touch on when we're educating the patients are the causes, the signs and symptoms to look for at home, things they need to avoid, and then lifestyle changes they may need to implement. So the causes, there's no really known cause, but you are going to look out for those risk factors, diabetes, hypertension, things like that. Let them know if they're at risk in the first place. Signs and symptoms to look for at home, their increased blood pressure. Let them know that headache with the vision changes, those are things that are indicative of a high blood pressure. Maybe let them know to buy a blood pressure cuff so they can take their blood pressure regularly. A headache, shortness of breath, right upper quadrant pain, and let them know where that is. And any kind of vision changes, those are all things that they need to be aware of and call a provider if they experience those. Things they need to avoid, limit salt intake, any kind of smoking, alcohol, obviously drug use. Let them know they need to talk to their provider about medications that they're on, if they need to stop any or start taking any medications, which leads us into lifestyle changes they may need to implement. So the lifestyle changes that they may need to implement include, like I said, medication adherence, which is huge. A low-dose aspirin regimen, if their doctor has prescribed it, has been shown to reduce the occurrence of HELLP syndrome in women with these risk factors. An exercise routine, something that they've discussed with their provider, something that they're able to do, is also important. Increase their fluid intake, and diet is also a big thing. Women who are obese are at an increased risk for developing HELLP syndrome, so just let them know that diet, exercise, and medication adherence are all really big in reducing their risks. Okay, so now that we finished the period of instruction, let's see what you guys have learned. Can anybody tell me the 3 or at least 3 signs and symptoms that you're going to see in a HELLP client? Candace?
You're going to see hypertension, so 140/90 or above. Another one, they're going to have really bad right upper quadrant pain. And then they can also have a really bad headache that makes them have vision changes.
Good, okay. How about the treatments that we're going to use to manage the signs and symptoms? What are the 4 proven treatments?
I can answer.
Sure, go ahead.
Okay, so first we want to get that blood pressure down, so we're going to give some really fast, rapid-acting IV antihypertensive drugs. And then secondly, we want to reduce the risk of the seizing, or risk for seizure, so we're going to give IV magnesium sulfate. And then we want to make sure that the baby, their lungs are maturing, so we're going to give probably some steroids, maybe betamethasone.
Yeah.
And then most importantly, we're going to induce labor and have the birth.
Right, we're going to try to hold off the labor until we get those drugs working, but you're right. If they're term, we're going to induce that labor because that is the only known cure to get the baby and the placenta out. And remember that in some cases, the risk does increase even after birth, so we're going to continue giving them mag sulfate, like you said, and even the antihypertensives via an IV. So lastly, some points that we can use to educate the at-risk client. Can you give me 4 lifestyle changes that we should educate the patient on?
Absolutely. So one risk that they could reduce is having a healthy BMI. So just teaching them a very balanced diet and make sure it's low sodium. And also things to avoid like smoking and to avoid drugs and alcohol. And then most importantly, teach them medication adherence. So if the doctor has prescribed antihypertensive medications, stick to those, and also make sure to take their prenatal vitamins.
Great, good job.
Hey guys, I'm Jordan, and I was just going to tell you a little bit about the handouts that you're going to pick out today at the end of class. So it's just going to go on your badge, and it's just going to be an easy and quick reminder for some of the interventions that we use for HELLP syndrome. So first it's going to talk about magnesium sulfate and why we administer that, which is to prevent seizures. And it's also going to list that we use IV antihypertensives. That's going to be to drop the blood pressure because we know with HELLP syndrome the blood pressure is always elevated. And then it's also going to talk about betamethasone, and that's a steroid used to increase the lung maturity for the infant because ultimately we are going to deliver the baby. And we just want to make sure that the lungs are mature enough for whenever they are born so that they can breathe effectively. And then it's going to talk about the use of like Pitocin and other methods to induce labor. Thank you, and I'm going to turn it back to Stephanie.
Okay, so that concludes today's huddle and our period of instruction for today. I hope you guys learned a lot, and also don't forget to pick up your info card. It's a little addition to your badge holder that just has some of the things that we went over today, including the 4 treatments, and just kind of goes into a little bit more detail. So I hope you guys have a great day.
Thank you.